Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. Welcome back to our ebook and video series. And this very important video is telling you all about the 10 things you didn't know about severe head or brain injuries in intensive care that you must know, especially if your critically ill loved one is not waking up, or if the intensive care team is suggesting a poor prognosis, or even worse, if the intensive care team suggests a withdrawal or a limitation of treatment. Just by you getting informed, you stand out from the rest of the families of critically ill patients in intensive care, and it will give you an edge when dealing with the challenges, the difficulties and complexities in intensive care. Our video and ebook series will help you to find your voice and will show you how to have peace of mind, take control, be powerful and influence decision making fast in the jungle of complexities surrounding intensive care. And it will more importantly help you to have peace of mind, be in control, feel powerful and influence decision making fast. In this video, you will discover the guide to the 10 things you didn't know about severe head or brain injuries in intensive care that you must know, especially if your critically ill loved one is not waking up, or if the intensive care team suggests a poor prognosis, or even worse, if the intensive care team suggests a withdrawal or a limitation of treatment. Thank you so much for being a follower of our ebook and video series and of our information. We believe we have valuable and important information to share for our readers and watchers, of course. But we also know that you and your family are searching and looking for information about the topics that are so vitally important for you, for your family and for your critically ill loved one. You see, if your critically ill loved one has just had a severe brain or head injury and is critically ill in intensive care, you are in one of the toughest and challenging situations there can be on this earth. I know from experience that when I first started working in intensive care more than 15 years ago, in the first intensive care unit that I worked in, we had numerous brain and head injuries, mainly after car accidents and falls, etc. I also remember when I first started looking after those patients with severe head and brain injuries and their families, I was so struck by the tragedy that these patients and their families experienced that I could barely cope doing the work that is required as a registered nurse in intensive care. Looking after patients with severe head and brain injuries and their families in intensive care was hitting me without any warning, and I soon learned that it can be extremely tragic for critically ill patients with severe head or brain injuries and their families. But it can also be extremely rewarding when one gets involved in doing the work, getting severe head or brain injury patients back on their feet again, and in the process also sees the families of those patients being much happier. And I also felt terrible, and I felt that being involved in looking after critically ill patients in intensive care with severe head and brain injuries is challenging. I know how you must feel as a family member if your loved one is critically ill in intensive care with a severe head or brain injury. But the reality and the fact of the matter is also that if I can cope with the challenges, the misfortunes and even the miseries of those situations, you can do as well. Never underestimate your family's and your critically ill loved one's resilience. Whilst we are not made of stone, we are all extremely resilient, because otherwise we wouldn't be here on this earth. You and I wouldn't be here today if our ancestors didn't know how to effectively deal with adversity, challenge, frustration and even despair. And I won't neglect the fact that severe head and brain injuries are one of the biggest challenges in intensive care. And I also won't neglect the fact that severe head and brain injuries can sometimes lead to the end of the life of critically ill patients in intensive care. But before you can come to the conclusion whether the end of life of your critically ill loved one after a severe head or brain injury is the only option, you really need to educate yourself as much as possible, and you want to make sure you know as much about severe head and brain injuries in intensive care as you possibly can. Therefore, without any further introduction, let's dive into the 10 things you didn't know about severe head or brain injuries in intensive care that you must know, especially if your critically ill loved one is not waking up, or if the intensive care team suggests a poor prognosis, or even worse, if the intensive care team suggests a withdrawal or a limitation of treatment. So, number 1. Critically ill patients with severe head and brain injuries in intensive care can take a long time to heal or recover, more time than anybody will ever admit to. So, when I say critically ill patients in intensive care with severe head or brain injuries can take a long time to recover, what do I mean when I say a long time? So, I have seen some critically ill patients in intensive care with severe head or brain injuries to be in intensive care for more than 6 months. The reason why they stayed in intensive care for such long periods was manifold. It was often a situation and a combination of those patients having massive issues with intracranial pressures, which is the pressure in the brain. It was also an issue of patients not waking up, patients often having a tracheostomy and being ventilator dependent, patients developing sepsis, which is basically an infection in the blood, patients developing acute renal or kidney failure, and just generally needing a long time to recover. As I have said before, severe head and brain injuries are one of the biggest challenges in intensive care, and the more time your critically ill loved one is given to recover, the better chances are to wake up and recover. Just take Michael Schumacher, the former Formula 1 world champion, who had a massive head and brain injury in January 2014 while skiing, and who was in intensive care for months. He's the best and also high profile example that intensive care stays after severe head and brain injuries can be extremely long. Let's move on to number 2. Critically ill patients with severe head or brain injuries tend to use up a lot of expensive resources in intensive care, and it therefore puts pressure on the budget and or on other beds in intensive care. The biggest elephant in the room when you are dealing with the intensive care team if your loved one is critically ill in intensive care with a severe head or brain injury is that severe head or brain injuries tend to be extremely resource intensive. Those resources tend to be time, money, staff's expertise, equipment, diagnostics, operating theatre, etc. The patients in intensive care with severe head or brain injuries tend to be ventilated for prolonged periods. They often end up with a tracheostomy, and they often end up using expensive drugs and medications. They also often have more CT scans and or MRI scans compared to other intensive care patients. Therefore, resource pressures can be immense. The intensive care team also knows that many of those patients can stay in intensive care for prolonged and long periods of time, and they therefore almost always weigh up the pros and cons of continuation of treatment. The intensive care team knows that if they are using expensive resources to get your critically ill loved one through the most acute and often life-threatening phase of their stay in intensive care, it can be followed by an even longer stay that takes up even more expensive resources. The average length of stay for severe head or brain injuries in intensive care tends to be a lot longer than for other intensive care patients. Therefore, whatever the intensive care team mentions to you about prognosis, diagnosis, care and treatment of your critically ill loved one with a severe head or brain injury needs to be viewed and analyzed in the context of resource management in the intensive care unit. If the intensive care team, for example, can foresee a high demand for their ICU beds in coming days or weeks, and they also know that some of those other upcoming admissions are making them money, or at least don't put too much pressure on their budget, the positioning of your critically ill loved one's prognosis and diagnosis may be determined by the elephant in the room, which is once again resource pressures and resource management. To give you a quick example how that may look like in the real world. Let's say your critically ill loved one is in a 10-bedded intensive care unit and has been there for the last 2 weeks after they sustained a severe head and brain injury. Your critically ill loved one isn't waking up, and they now have a tracheostomy and they are still ventilated. The intensive care team is rather negative and pessimistic about the outlook of a recovery of your critically ill loved one, and they have already painted a doom and gloom picture. They have hinted towards a withdrawal of treatment and a limitation of treatment as quote-unquote in the best interest of your critically ill loved one. Even though you and your family know that the neurosurgery team who initially operated on your critically ill loved one's brain when they first came to the hospital after they had a severe car accident, they are still optimistic, and the neurosurgery team says that your critically ill loved one will recover. So you and your family are under the impression that it's the intensive care team who wants to call the shots, so to speak. And there is a reason for that. The intensive care team wants to call the shots for a number of reasons. For one, they know that in such a small intensive care unit with 10 beds, one patient who is blocking a bed can lead to a refusal of other admissions that would most likely be less resource intensive, they would be less demanding and challenging, and that would also be less emotionally and mentally draining compared to a severe head and brain injury patient. They also keep other stakeholders in line, and they want to do proper stakeholder management, and they have that in the back of their minds. They may have some other powerful players who need regular ICU beds for their patients that they want to keep good relations with. The bottom line is that you and your family need to have an awareness of the elephant in the room, because the elephant in the room will always dominate every conversation, and it will dominate the positioning of your critically ill loved one's prognosis and diagnosis, especially if they are not recovering quickly, if they are not recovering in a time frame that is convenient for the intensive care team. Let's move on to number 3. The intensive care team and the neurosurgery team often have contradicting views and opinions about the prognosis of severe head or brain injuries. Now, the intensive care team and the neurosurgery team often have contradicting views and opinions about the prognosis and diagnosis of your critically ill loved one with severe head and brain injuries. The reality and the fact of the matter is that in most instances after severe head and brain injuries, the neurosurgery team is involved often right from the start, because they are the ones who operate on your critically ill loved one's brain. They may remove part of the skull, not only to reduce the brain pressures, they may also remove some of the bleeding, etc. The neurosurgery team may also insert an intracranial pressure monitor, or an EVD, which is an extraventricular drain, or an ICP, which is an intracranial pressure monitoring, so that the intensive care team can continuously monitor and manage the pressures in the brain. As a rule of thumb, the neurosurgery team will always tell you that the operation went well, and they will never tell you that the brain surgery was not successful. The intensive care team will most likely take a different stand, and they often have a different point of view as they look more at what's happening in intensive care. They may be more cautious, more negative, and more conservative in their outlook about your critically ill loved ones diagnosis and prognosis. And once again, behind closed doors, the intensive care team and the neurosurgery team will often discuss your critically ill loved one's case, and even if they can't agree on future prognosis, diagnosis and treatment, they still don't want to be seen as not speaking with one voice when talking to you and your family. They probably still end up disagreeing, but they have to find some sort of compromise that they can present to you and your family. As a rule of thumb, in most intensive care units, it's the intensive care team who has more power than the neurosurgery team. It can be different in some intensive care units where they have a really renowned or famous neurosurgeon. Where the intensive care team and the neurosurgery team often contradict on is the future of your critically ill loved one, or more importantly, how to get to the future of your critically ill loved one. From the intensive care team's standpoint, they want to minimize the resources used to get to the future, and from the neurosurgery point of view, they are more interested in showing proof that their surgery and treatment was successful. But if the intensive care team doesn't want to give your critically ill loved one the time to recover, and if they push for a withdrawal of treatment or for a limitation of treatment, your critically ill loved one might be dead, and the neurosurgery team is certainly not in favor of prematurely stopping or reducing treatment. Therefore, for you and your family, it's very important that you have an awareness of those dynamics, that you speak to both parties in the process so that you get a feel for the people and that you get a feel for where they stand. Number 4. The positive or the negative culture in an intensive care unit can make or break the recovery of your critically ill loved one with a severe head or brain injury. Intensive care, just like any other working environment, is a place of culture. Just like where you work, there is a certain culture, and that culture is not only driving everything that is happening in the environment, it can also make or break the results people achieve. This is not any different in intensive care, as you can imagine, and the either positive or the negative culture in an intensive care unit will often determine how the intensive care team frames the situation. It determines how the intensive care team positions themselves and your critically ill loved one's prognosis or diagnosis. It also determines how transparent the intensive care team is in their dealings and discussions with you, your family, and your critically ill loved one. Many intensive care units tend not to be transparent in their dealings with families of critically ill patients because there is far too much at stake for the intensive care team. Therefore, you need to be prepared that many intensive care units present your critically ill loved one's case in a more negative light rather than in a hopeful and positive light. Furthermore, you and your family also need to be vigilant in how the intensive care team react to your questions. Are they responding with patience, compassion, and understanding? Or are they responding with impatience? Are they giving you some funny looks? And most importantly, are they transparent in their answers? The other thing you need to be mindful of is that the intensive care team, or if some members of the intensive care team have contradicting views about the situation of the diagnosis and or the prognosis of your critically ill loved one, there could even be an internal power struggle going on. Sometimes what happens is that mainly the senior doctors involved in the care and treatment of your critically ill loved one may not agree on the direction they should be taking. Therefore, treatment might get delayed. Open and transparent discussions may not be held as well. Especially if your critically ill loved one is in an intensive care unit with a severe head or brain injury, the positive or the negative culture in an intensive care unit can make or break your critically ill loved one's stay. You see, it doesn't take much to become negative, cynical, or pessimistic when your loved one has been admitted to intensive care with a severe head or brain injury. The major difference that I have found in more than 15 years intensive care nursing in 3 different countries is that the intensive care units who have a positive culture tend to give head and brain injuries enough time and resources to recover, and they really nurture those patients to the best of their abilities. In an intensive care unit with a positive culture, those patients are given a good and fair chance to recover. No doom and gloom scenarios are being painted. Those intensive care units with a positive culture tend to be transparent. They get families of critically ill patients involved in the decision-making process, and everybody seems to be on the same page. Those intensive care units also tend to have a can-do attitude. On the other hand, in intensive care units with a negative culture, intensive care teams are very quick in painting a doom and gloom picture, especially when it comes to severe head and brain injuries. There was one intensive care unit in particular that I worked in that was very quick in painting doom and gloom pictures for severe head and brain injury patients and their families from the very start. The intensive care team there was also very quick in suggesting a withdrawal of treatment and or a limitation of treatment for patients with severe head and brain injuries. In those intensive care units with a negative culture, the intensive care team makes sure that from the start, families of critically ill patients almost felt intimidated from the start. Therefore, more patients were not given a fair chance of recovery, and many patients died because the intensive care team was very adept and shrewd in selling to families of critically ill patients that a withdrawal of treatment and or a limitation of treatment would be, quote unquote, in the best interest of their critically ill loved one. Many of those critically ill patients with severe head and brain injuries in intensive care with a negative culture never saw the light of the day, so to speak, because the intensive care teams in units with a negative culture tend to be so preoccupied by getting their way, and they are so preoccupied of managing or even micromanaging the process around not spending too many resources and time on patients they deem as quote unquote hopeless cases. The reality is that many critically ill patients in intensive care with severe head or brain injuries who end up in an intensive care unit with a negative culture are not given the chance to come to the point where they may get a tracheostomy, where they may get mobilized in a chair, where they may get taken out of an induced coma, etc., because the intensive care unit has already made up their mind that they are not going to invest any more resources, and they're not going to invest the emotional energy it takes to get those patients out of intensive care and get them better. And as I said, and with resources, I not only mean financial or equipment and or personnel, I also mean those emotional resources one has to invest to get your critically ill loved one with a severe head or brain injury through that difficult period. In units with a negative culture, the emotional resources tend simply not to be there, because usually there is one or a few power players in the unit who are responsible for the negative culture, and they tend to keep a lid on the pot, so to speak. Their interests tend to override everybody else, and their often dictatorial leadership style tends to drive the negative culture in the unit. So, this is the finish of part number 1 of this video. Just go below this video and click on the next video to watch part 2. Thank you.